My name is Susan Whyte, and I am a professor of anthropology, University of Copenhagen. And I have practically my whole career done fieldwork in East Africa, especially in Uganda. Global health should be about how not only diseases, but people and ideas, medicine, technology, how they travel, how they move from one country to another, from one part of the world to another. So when we say global, we should mean global. I think as a social scientist, you have to say that the most important topic is inequalities and what they have to do not only with health, conditions of life, but also with the way people are able to access healthcare. Second topic that I think is important is how, what I call actually existing healthcare systems. How healthcare systems really work and how they are actually composites of different sections. Number three, I would like to think about how sicknesses change in people's awareness. How does a sickness burst into consciousness? It's an enormous challenge that the public health services are so underfunded, under-resourced. In Uganda, I think about health facilities are about less than 50% at the staffing level they should be at, all over. Medicines run short. The diagnostic equipment that should be there often is not there. So the part of the healthcare system that should be providing free service for everybody that needs it doesn't have the funding that it should have. A second problem is that at least in African countries, healthcare is more oriented to acute infectious conditions than it is to chronic conditions. From where I stand, I think a challenge is for we who are researchers to think again about the nature of our collaboration with other researchers from countries of the global south. Perhaps we should look more closely at how health systems, in that broad sense that I mentioned before, how they actually are functioning, and most important, how are they changing? And how do the changes affect the perceptions of users, their willingness to seek help from one part of the system rather than another? And if you look at not what it should mean, but what it, in use, what the term actually comes to mean, I think it's interesting that people who are researchers from countries like Uganda, so how do they study global health? They will be expected to do studies in their own country if they're going to get funding from countries like Denmark. So that kind of very broad view of the whole globe, I think, is a privileged view from the North, more than it characterizes the view of public health problems in the global South. I hope that in the coming 10 years, this is something we will be thinking about.